Hello everyone, मेरा नाम तन्मय शाह from Abroad Education Consultancy. Today I introduce to Dr. Maitri Shah. She has done her MBBS from Georgia and she let to know about the journey of MBBS abroad. Hello Maitri.
Hello everyone, I'm Dr. Maitri Shah, newly graduate from the Tvildiani Medical University, Tbilisi, Georgia. I am from 2016 batch and I have got a lot of aid from Abroad Education Consultancy, and with proper guidance of Tanmay sir, I was able to complete my medical course, which is a 6 years course, and currently I'm pursuing my internship in Civil Hospital, Baroda.
Nice. So Maitri, आपने MBBS के लिए अब्रॉड सिलेक्शन किया. अगर आपको इंडिया में भी, मेरे हिसाब से आपको इंडिया में भी यहाँ पर सीट्स मिल गई थी, तो आप पेरेंट्स को और स्टूडेंट्स को ये बताएंगे कि आपने अब्रॉड में एडमिशन क्यों से लेनी है, अब्रॉड में क्यों लेना पसंद किया?
ओके, तो यहाँ पे 2-3 फैक्टर्स है जिसको मैं हाईलाइट करना चाहूँगी. सबसे पहली बात ये होती है कि एक मेडिकल कोर्स है या जर्नी है, उसमें MBBS की जो डिग्री है, इट इज जस्ट अ बिगिनिंग, इट इज अ स्टार्टिंग स्टेप. सो उसमें ऐसा है कि you also have to consider your financial course. So when I compared the total cost of 6 years study in India and in abroad, that is in Georgia, it was showing significant difference. अभी उसमें ऐसा है कि you know the whole drill. You have to attempt for NEET UG. उसके बाद आप लोग को एडमिशंस मिलते हैं. अभी उसमें ऐसा है कि we all are aware about the reservation and the other problems that follow. So I have friends who have done their MBBS from India in management quota, but उनको जो overall cost पड़ी थी, it was almost double to 3 times as compared to what I had spent. So that is something which you need to keep in mind. वैसे देखने चाहो तो DTMU की फीस उस टाइम पे it was $6,000 and I am mentioning about the fee structure that was 6 years ago. So my overall cost came down to somewhere around $8,000 to $9,000, including accommodation and other added expenses. उसके comparison में I have a friend who was a classmate. He is a friend of mine right now. उसने 1 year की 12 lakhs fee pay की है, and that is just for a year. So that narrows down to somewhere around $11,000 to $12,000.
So, Maitri, tell me one thing. What are the difference between the Indian education system and abroad education system? You get any benefit in studies? So just brief. Yes.
Okay, so there is some sort of difference between education in India as well as abroad. सबसे पहली चीज ध्यान में रखनी जैसी ये है, that is curriculum. इंडिया में जो curriculum है, it is patient centered, concept centered and everything. But there is something called as reference books. उसमें in-depth knowledge होती है, which is usually taken up by students who are preparing for NEET PG exams. Whereas जहाँ मैं पढ़ी हूँ, that is DTMU, हमारी जो main books थे, they were the reference books. So हमारा knowledge from day one was always one level higher. इसमें difference ये आता है कि you are not focusing on scoring, or excelling in med school. This, however, is important. तो ये समझना बहुत जरूरी है कि medicine is all about concepts. The more you understand to apply the concepts, the better doctor you will be. Yeah, India में ऐसा है कि you are supposed to give written examinations until your final years. But what we practice in Georgia, that is in DTMU especially, was we had MCQ based system. We had a 3-hour test with 180 MCQs, and we were supposed to apply our concepts to each and every question. So what this helps us in doing is, it helps us in making quicker decisions when it comes to patient. For example, currently we are allotted patients from where I'm practicing, that is in civil hospitals. You all must be knowing there are ample amount of patients every day. So whenever you have a patient with you, you are supposed to look for the critical signs or symptoms, or you're supposed to relate with the knowledge that you have. So this comes with practice, and we have been practicing these concepts from day one of our college. So that is very important.
मैत्री, आप मुझे बताइए जॉर्जिया सिलेक्शन आपने किया, एनी रीजन बिहाइंड जॉर्जिया?
There was particularly one reason that I would like to mention. First of all, ऐसा था कि when I was going through this journey of selecting a college, I was, to be honest, very confused. अभी उसमें ऐसा है that there are other countries, for example, Russia, Philippines, China, on the top of the list. But Georgia was very new at that time. And when I researched about it, the geography, the politics, because these aspects are really very important when you are considering moving there for 6 years. So उस time पे Georgia was the best choice, and hands down it was the best choice I made, because Georgia is legit my second home. It has given me many memories. It has made me a person that I am today.
Definitely, that's nice. मैत्री, एक चीज मुझे बताइए कि अब्रॉड में जो स्टूडेंट्स पढ़ने जाते हैं और वापस जब इंडिया में वो आते हैं, तो उनको स्क्रीनिंग टेस्ट देनी पड़ती है इफेक्टिवली। एंड बहुत लोग कहते हैं, बहुत लोग बताते हैं कि इंडियन स्टूडेंट्स को कहीं ना कहीं पार्शियलिटी होती है, इंडियन स्टूडेंट्स की कंपेयर में अब्रॉड वाले स्टूडेंट्स को कहीं ना कहीं पार्शियलिटीज होती है। इज दैट ट्रू? क्योंकि आपने तो फर्स्ट टाइम में अच्छे स्कोर से अभी अपनी स्क्रीनिंग टेस्ट कंप्लीट की, तो लेट मी गाइड कि इसमें क्या रियलिटी है।
सबसे पहले हम समझने की स्क्रीनिंग टेस्ट होता क्या है। तो इसमें ऐसा है कि इंडिया का एक सिस्टम है, मेडिकल सिस्टम, दैट इज बाय नेशनल मेडिकल काउंसिल. सो दे हैव देयर क्राइटेरिया of the amount of knowledge that you have to be able to known as a doctor, okay, or to be registered as a doctor. तो जो education या जो experience Indian doctors को मिला है, to match that, they just have this screening test just to make sure that students who are coming from abroad, mark my words, I'm not just saying just from Georgia, I'm saying from abroad. That includes countries like Philippines, Russia, China, or any other countries that Ukraine, or any other countries that students might be coming from. तो जैसे कि सर ने बताया कि I have completed my FMG screening test in the very first attempt with the scores of 188, which is quite good. So उसमें ऐसा है that first of all, as I mentioned, हमारा जो education system था college का, that had played a huge role. And secondly, you have to be dedicated. You have to be dedicated because आप जो पढ़ेंगे, आप जो समझेंगे, it is entirely upon you. You have your faculties, your college, your mentors helping you out throughout the way, but at the end of the day, it's you who has to seize your day, right? So when it comes to partiality, I don't think so. FMG or screening test has anything to do with it. Students might say that you have to face partiality when you're doing your internship. It is true in some cases, but from my personal experience, I have never experienced such a thing.
So your experience share that there will be no worry about the FMG exam.
There is nothing to worry about. You go from here with a clear goal that you are there to become a doctor, to study well, and you just stick to it. That is what I have done, and I was able to get the result that I desired. So you don't have to be scared of exams. MBBS or medical in general is all about exams, so you do not have to worry about it. You just have to be disciplined and motivated every single day.
That's nice. Another question, मैत्री, बहुत से students कहते हैं कि MBBS abroad से करने के बाद इंडिया में जब internship के लिए हम लोग apply करते हैं, तो उसमें भी abroad students को कुछ partialities होती है. They need to pay some amounts as a bond or anything. तो अभी जो नया rules regulations आया है और उसमें और पुराने में क्या differentiate है? And what benefit you get from this new rules?
Okay, so अभी जो 2022 में बुलाया है. I am a graduate of July 31st, 2022. So ये rule मुझे हमारी बैच में applicable है. So the rule states that we should not be treated indifferent from Indian medical graduates. So पहले ऐसा था that you had to pay a minimum amount of a lakh or more if you wanted to do your internship. And by the way, internship is important if you want to get your permanent registration in India. So उस time पे ऐसा था that you had to pay the bond and you were not even entitled to stipend. But according to the new rule, which is applicable to us, we are not supposed to pay any fees as for doing internship. And on top of that, we are entitled to the same amount of stipend which is given to Indian medical graduates. So it is like a cherry on top of cake.
So again, there will be no worry about the internship, and whatever the internship you will get, you are satisfied.
The internship, internship that I have got currently, I am satisfied with it. Stating that what I am like, why am I doing internship? Of course, for permanent registration, but it is for experience as well. The more experience you gain, the more confident you are, and the better your knowledge gets.
Definitely, that's good. मैत्री ये बताइए कि आफ्टर MBBS हर स्टूडेंट्स नीट पीजी के एग्जाम के पीछे लग जाता है, तो आपने एक नया ऑप्शंस क्रिएट किया प्लेब की एग्जाम्स के लिए, यूके के लिए आप प्रिपरेशंस कर रहे हैं, तो ये मेरे स्टूडेंट्स जान सकते हैं कि प्लेब करने के पीछे के रीजंस क्या हैं?
So currently जैसे सर ने बताया कि मैं अभी internship कर रही हूँ, but I am also studying for next exam and lab is my option as well. The reason being I still have a year to go and next exam और NEET PG जो exam है काफी competitive रहता है, and that is the difference between the Indian exam for PG and for lab exam. So lab exams क्या है? There are two steps, lab 1 and 2. So ये जो exams है वो UK के लिए है. तो इसमें जो lab exam है, it is pass or fail, just like FMG exam. Whereas NEET PG or next जो है, it is rank based. You need to score more if you want to get into government college, because as we can say again that government, maybe there are somewhere around 20 to 25% of students who are getting into PG. So दूसरे जो 70 80 जो भी है percent students, they are bound to get into management quota. So it is just not feasible for many students.
That's nice. So, that explain how was your experience through abroad education consultancy?
Well, I would like to say that abroad education consultancy was like a savior for me. The reason being that there was this time period after my 12th boards that I was really confused of what I should do. I was getting into government college in dental, but I was very much determined that I wanted to pursue medicine only. So I got to know about a sir from a family friend, and I approached him, and I got to select one of the best options, and it was one of the best choices that I made of my life. And today here I am, Dr. Maitrisha, after 6 years of hustle, and I could not be more happier.
Any message for the students, those who are going to doing MBBS in abroad?
Yeah, definitely. I have one message for you. Set your goal straight. If you want to pursue medicine, you do not have limited options. You have many options. You just have to take that leap of faith. You have to explore your options, and you can do it. Yeah.
So, any message for abroad education consultancy?
Well, they are doing the best that they can. So, none for now, but thank you for having me so that I could share my experience with the future doctors, and I will be glad to help any of you if you may need.
Thank you, Maitri. It was nice meeting with Maitri Shah. Students, आपको इन फ्यूचर कोई भी रिक्वायरमेंट हो तो आप हमें अब्रॉड एजुकेशन कंसल्टेंसी को आप हमारी वेबसाइट्स पर जाके हमें कांटेक्ट कर सकते हैं। स्क्रीन पे दिए गए नंबर पर आप हमें कांटेक्ट कर सकते हैं। आप हमारे यूट्यूब चैनल पर कमेंट कर सकते हैं और आप हमारी ऑफिस पर भी आप पर्सनली विजिट कर सकते हैं। आशा करते हैं कि हमारे ये कम्युनिकेशन से आपको रिक्वायरमेंट्स वाली सारी इंफॉर्मेशन मिल गई होगी। धन्यवाद।